Methodist Hospital of Southern California presents a Medical Minute on ACL injury in the knee with Dr. Gregory Heinen.
The ACL is a ligament in the center of the knee. Typically, we talk about 4 ligaments in the knee. On the inside here is the medial collateral ligament, or MCL. On the outside here is the lateral collateral ligament, or the LCL. And as we bend the knee, right up the middle are the cruciate ligaments. And this one right here would be representative of the ACL. And this is the meniscus. And the meniscus is a shock absorber between the 2 bones that we discussed. And as it may get damaged, it could cause damage to the articular cartilage, which we know as arthritis. When we do an ACL, we don't just take the 2 ends and sew them back together. We actually have to replace it and make a new one. This is a surgery that's been dynamic over multiple decades. It has improved dramatically. You're able to give patients a quality of life, and people see it. It's not only preventative for the future, but it allows them to function now.